So a lot of my clients come to me for irregular periods. So let's talk about it in detail today in this video. Hello everyone, I'm Dr. Maalavika Appasani, Cosmetic and Functional Gynecologist from Eternelle Aesthetics, Hyderabad. First period in a girl's life, which is also called as menarche, is very important milestone and it is suggestive of everything being normal in a female body. So this first menses or period starts in girls between the age of 10 to 15 years. Generally, the hormones first release in the brain and then slowly they reach the ovary. This causes endometrium. This is the lining of the uterus. The growth of the tissue, growth of endometrium happens, and finally there is withdrawal bleeding, which is nothing but menses. And these periods, they tend to settle down within 5 years of attaining first menses. In this 5 years, the hormones, they try to fall into normal pattern and finally regularize themselves so that periods are regular. That is once in 28 days. So if the periods fall into line within first 5 years, then it's okay. If not, then maybe you can call them irregular cycles. We call a period as irregular period if they are too short. That means the periods are very short cycles every 22 days, or if the periods are too long, that is if the period is not attained for more than 35 days. These are called irregular periods. And generally the causes for irregular periods are any hormonal imbalance or any thyroid disorder, which is the most common. And also we can't forget PCOS because of obesity or insulin resistance, all these factors, or any other conditions like fibroid uterus or any polyps or any other structural anomalies in the uterus. All these factors may cause irregular periods. So when to meet your doctor for irregular periods? It's always advisable to watch at least 3 consecutive periods, and if they are still irregular, that is when you see your gynecologist. And before seeing your gynecologist, make sure you track your periods so that you can easily explain when is your period starting, for how many days was your flow, and then when is the next cycle. This will help us to diagnose the condition exactly. Is it a short cycle? Is it a long cycle? Is it menorrhagia, that is heavy period? Is it a scanty flow period? All these conditions. This will help us to get into a better diagnosis so that we can treat your condition. Many of my clients also come with history of using OC pills, that is oral contraceptive pills, or even IUCDs like a copper T, etc. for contraception. While using these pills or other IUCD devices, it should be kept in mind that you can't miss pills in between. This might lead to irregular cycles, and also some clients take emergency contraceptive pills like I pills. These might lead to causing irregular cycles. So that is why it's best to use all these pills only with doctor's advice. Now that you know all about irregular menses, if you are having irregular cycles, please visit your gynecologist and get it treated. Always do remember that regular periods is a sign of healthy body. If you have any more doubts, please comment below so that we can revert back to you. And if you like this video, please press like and subscribe to our YouTube channel. And don't forget to press the bell icon for our latest video updates.